Sometimes when you get injured, the word surgery gets thrown into play. There are some injuries that require surgery, like an Achilles rupture, and that's quite immediate. However, with most injuries, surgery isn't always the first thing, and if not, it should always be the absolute last thing you consider. These are my 3 tips to consider before you get any sort of surgery following injury. The first thing is, have you tried 8 to 12 weeks of physiotherapy rehab? The evidence for physiotherapy with most injuries is as good, if not better, than surgical outcomes. So make sure you've tried 8 to 12 weeks of physiotherapy first. The second thing is, what are your reasons of getting it? Do you need it? Do you have work? Do you have financial commitments? Do you have children? Will these things affect you if you get surgery? And do you need it? If you'd like to run, you don't need an ACL. You can run and do straight line running without an ACL. It just needs to be rehabbed prior to doing that. The third thing to consider is, what does the evidence say? We have access to Google, we live in a virtual society, so make sure you get online, have a look and see what the evidence says. And unfortunately, there's some really good evidence coming out these days to show that surgery might not be everything it makes out to be. So physiotherapy, ask yourself the questions, have a look at the evidence, and make an educated decision before you get any sort of surgery.